Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Preventing neural tube defects. Introduction. Neural tube defects, or NTDs, happen when the spine and brain do not develop completely while the fetus is forming in the uterus. At the beginning of pregnancy, the brain and spinal cord start out flat and then roll up into a long tube. This neural tube grows to become the brain and spinal cord. If the tube does not close all the way, any part that is still open becomes a birth defect. This health education tutorial explains what neural tube defects are. It also discusses how women who have had pregnancies with neural tube defects can use folic acid to prevent these defects in the future. Neural tube defects. Some examples of NTDs are spina bifida, anencephaly, and encephalocele. NTDs vary in severity. Some NTDs, such as spina bifida, can be mild with no or few symptoms. Other NTDs, such as anencephaly, can be fatal. Certain seizure medicines can cause NTD. Sometimes NTDs run in families, or they may be part of a genetic disease. Prevention. The exact cause of NTDs is not known, but a B vitamin called folate or folic acid may help if taken just before pregnancy and during the first few weeks. Folic acid is found in regular daily multivitamin tablets, prenatal vitamins, and in certain foods. While you are of childbearing age, even if you use birth control and do not plan to get pregnant, you need to take folic acid. Many pregnancies are unplanned. You should take 0.4 milligrams of folic acid each day. It is not safe to take several multivitamin pills daily to obtain the correct amount. Extra doses of other vitamins might be harmful. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. New pregnancy after an NTD pregnancy. It is important for mothers who have had NTD pregnancies to plan ahead and start taking folic acid if they want to have another baby. This is because the neural tube closes before most women know they are pregnant. Mothers who take folic acid 3 months before and during the first 3 months of pregnancy can reduce the chance of having another NTD pregnancy. Some developing babies seem to have a high need for this vitamin, so it is important for women who have already had a child with any NTD to take extra folic acid. The chance of having another NTD pregnancy is usually about 4%. Women who have 2 NTD pregnancies have a 10% chance of having another. For most women, but not all, the risk is reduced by 2/3 when taking the recommended amount of folic acid before and during pregnancy. Women who have had a previous NTD pregnancy should take 4 milligrams, 4 mg, every day when trying to become pregnant. See your doctor to get a prescription for the right amount. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. If you had a baby with a neural tube defect and are planning another pregnancy, remember the following 4 points. 1. Use an effective method of birth control until you decide to get pregnant. 2. Talk to your healthcare provider before you stop using birth control and ask for a prescription for folic acid vitamin supplements. 3. Start taking your folic acid prescription before you get pregnant. 4. Once you are pregnant, continue to take folic acid every day until your healthcare provider says you should stop. Thank you for using Explain.